Thank you. Your Excellencies, distinguished guests, ladies and gentlemen, I would like to welcome each and every one of you to this very beautiful gathering. I know we're actually supposed to have started like 20 minutes ago, and we're going to be doing this in a very simple, straightforward, and very interesting way. Permit me at this point to welcome most especially friends and family, doctors, professionals from different parts of the world that are here to support this very beautiful movement. And before we actually start, I would like everybody to please greet the person sitting next to you. Greet the person sitting next to you in your own language. If you're French, bonjour. If you're Kanuri Indarupto, you know, it's a big country, a lot of ethnic groups. Aha, kilo shele. If somebody is saying what you don't understand, just say, We're good to go. So, ladies and gentlemen, it's all about skincare this evening, and we're here to have a very good time, even while we launch some very special things that I will not let the cat out of the bag. We have beautiful professionals that are going to be up here on the microphone to say all the positive things that need to be said. So, permit me to welcome each and every one of you here. And if you're still not seated, please kindly find somewhere and make it. And we're going to be live. So before we go live, I've got like 4 doctors, I think with a professor, that will be making remarks about certain things that I'm sure they've been briefed. So we'll have to keep it, maximum 5 minutes, so that at least the official lunch is going to be captured live. By the time we prolong, our timing might not be exact when the official launch of the products or the system that we need to launch here this evening. So this is just like a heads up. So once the signal is gone, we're going to start running any moment from now. So in the next like 3, 4, maximum 5 minutes, we'll start. My name is Abdul Bulamasmai, and I welcome you all to this very beautiful Niger Skincare Center here. A very special launch of something special. Okay. Are we seizing? Okay. Maybe this mic is not used to this weather. This is like Moscow. You know what I mean? Yeah. London. Yeah. All right. So it's okay. So we're good. So Mo Jazz, 5 minutes, bingo. And please just. And can we change this microphone? Yeah. I can't be doing this live. Network. This is 92.5. This is Niger Med Skincare Nigeria. All right, this is better. Most of this English now, cramming. Once I see balance, you go clear. It's been long. I was on suit. Wow. My wife was like, "Oh, you look so take away." I said, "Take me away, baby." I'm always in Agbada, up north and stuff like that. So, ladies and gentlemen, please relax. It's a beautiful evening. Exchange pleasantries and what have you. And we'll try as much as possible to cut across everybody here. The Indi Igbos, the Yoruba, Americans, Arab, the Hadare, Sekullah, Indian, Landarke, Bolo Boloke, just to make sure everybody relax, So in case, if any, we just want to make sure everybody is. And do I need to change the position here? Okay. You go walk there.
We are live at A-Class Event Center at the launch of this Niger Med Skincare. Niger Med Skincare began with one simple observation. Across Nigeria, people were struggling with skin issue that didn't match the solution on the shelf. Ash products, imported formulas, and one-size-fits-all routine wearing to working for skin shaped by African weather, lifestyle, and genetic. This night we'll be launching a machine that will take care of all these, that will take care of the acne. I'm going to be your commentator throughout the program. My name is Kike Lomo Okere.
Ladies and gentlemen, the arrival of our very special guest, the Honorable Minister for Agriculture and Food Security, in the person of Habu Kyari. A round of applause for him, ladies and gentlemen. You're welcome, Honorable Minister. Thank you. Your Excellencies, the Honorable Minister for Agriculture and Food Security, Honorable Abubakar Kyari, permit me at this point, ladies and gentlemen, to welcome our friends and family from different parts of the world that are here seated, and our members of the press. Permit me to kindly request that we have a little attention here, even as we're about to commence this very beautiful program. Distinguished guests, ladies and gentlemen, members of the press, permit me to say that this evening we're here to celebrate something that is very important, not just to life, but of course to humanity. And to kickstart this program, to talk about skin, not just skin care, the Niger Med Skincare Center here will be officially doing something very special, not just in Nigeria, but it's beyond that. And to summarize most of these things that are this evening, we have professionals that will do and take most of these things in specifics. Permit me to welcome, if your hands are not busy, the man to officially open this beautiful event, and the one and only, a professional of the skin. Let's welcome Dr. D to the microphone. Please a round of applause for him, ladies and gentlemen.
Can I climb up or do it here? It's okay. Hello everyone. Oops, too loud. Hello everyone. My name is Dr. Dan Malam. He said Dr. D, that's aka Dr. D because it's a lot easier. And I am the MD CEO of Niger Med Skincare. I would like to thank everybody, welcome everybody, for taking your time out to attend this beautiful event, this important event to us. We thank God for giving us the opportunity to have this sort of event. An event where we would be launching two important machines in the treatment of skin. We have some guests We have some professors, we have dermatologists, we have distinguished guests. But I would like to take opportunity to thank everybody for coming. We have some guests that came all the way from Europe because the lasers we are launching are Italian lasers. We have the person who is in charge in the company for Africa. He is around, Mr. Alex Bondi. Yes. We have our partner, the person who is in charge of our European Niger Med Europe. He is the MD of Niger Med Europe, Dr. Petio. And we have the MD of our Spanish office, so to say, Mr. Patterson from Collins Consulting. They are our guests. They came all the way from Europe. They arrived yesterday to celebrate with us. The two lasers we are launching today, eventually you would hear all about them. One of them is for the treatment of acne. Acne is the most common condition in young people. Over 80% of visits to dermatologists, the complaint is acne. It's an American invention produced by this Italian company. It's a 10-year process. It took them 10 years to produce this laser, research, production, and employment. So I am profoundly happy and glad that all of you have taken time out to come and join us in this celebration. I thank you very much, and I hope all of us would enjoy this precious moment, precious for us, precious for our patients, precious for everybody that is here, and even those that are not here. Thank you very much.
Thank you very much. Permit me at this point, ladies and gentlemen, to welcome Alex Bondi. A round of applause, ladies and gentlemen, as he comes up.
Hello everybody, buonasera. And some of you already knows me. I came last year, the first time to Nigeria. And thanks to Dr. D, I would like to thank you, Dr. D, first of all. I came back to Abuja because in very few words, very simple words, we have a dream. And the dream is to bring to Africa the best technology, the best machines to treat the skin conditions. It was not easy. The project is very big. It's not only for Nigeria. It's for the whole African continent. And let me say a few words about Quanta Systems so you can understand who we are. We are a laser manufacturer. We are the #1 in Europe. We are the #3 in the world. And in very simple words, we love to play with light. We do everything with light because light is the most natural thing you can use to cure the skin, to cure yourself. And we concentrated our attentions on two technologies. Some of you will remember we launched the first technology last year in Lagos, the Pico, and it was the very first Pico in Sub-Saharan Africa. And now, tonight, thanks to Dr. D, we are going to launch the Accure. The name of the machine is the Accure. It's the very first technology worldwide able to treat acne in a very effective way, just with light. And this is very important. So I think I have to say thank you to you, because thanks to you, we could realize our dream. Believe me, it's a big honor for me to speak from here. So once again, thank you everybody for coming, and enjoy the night.
Thank you very much. Thank you. A round of applause for Mr. Bondi. Thank you very much. That is the Italia. Okay. spaghetti and pasta. Milan. Thank you very much.
That was Bondi and Dr. Dan Malam Musa. Says the innovation rarely happens overnight, and the story behind this breakthrough is a proof. What began as an American concept, an idea rooted in advanced dermatological science, found its perfect manufacturing home in Italy, a country globally recognized for precision, cosmetology, and high standard skincare production. For 10 years straight, researchers, formulators, and engineers worked quietly behind the scene, refining, testing, and rebuilding every element of this technology. It wasn't just about mixing ingredients, it was about designing a formula that could stand to clinical scrutiny, environmental challenges, and real human skin.
It is an honor and privilege to be present in this very important launch. And it gives me opportunity to see many of my colleagues, both senior and junior. Several generations of dermatologists are here. Can I have my slides so that I can start? So talking about acne vulgaris, that one we all know simply as pimples, because I know there are many non-medical people here. Pimples is one of the commonest complaints we get in the various skin clinics all over. Most of them are mild. However, no matter how mild they are, usually there's some accompanying psychosocial problems that make it a very important thing, especially among young people. The psychosocial effects may far outweigh the physical impact of the disease. Therefore, anything that seeks to treat and cure pimples is highly welcome. So I'm sure this new system is going to be very useful in our dermatological practice. So like I said, pimples is a very common disease. It occurs in young people mostly, people in teenage years and early adulthood. And therefore, we see it as a problem. You see, when you get a young lady who is preparing to marry and has all these things on the face, they will come to the clinic and tell you, please get rid of this for me in the next few weeks before my wedding day. So I'm sure these new technologies are going to help dermatologists achieve this feat. It's common, and a lot of the time there are many factors responsible for this problem, to the extent that it's now looked on by many people as normal. So there are genetic factors, there are hormonal factors, there are possibly dietary factors that give rise to this problem. So pimple, as we know it, occurs almost in everybody. Only a few exempt in that age group, the teenagers, and there are changes in the body where children become teenagers. The surge of hormones usually will precipitate these pimples. Some people, diet responsible, but we are professionals, we are not too sure of that. But some people, they say, when I eat granite, when I eat this, the pimple flare up. And moreover, certain conditions like pregnancy may precipitate pimples. Certain drugs like steroids can also precipitate a lot of pimples. And then you also have certain cosmetics. There are many cosmetics in the market. When you rub them on the body, it blocks the pores through which some of these chemicals come out, and they give rise to pimples. We call them comedogenic. Right. So these are my slides out now. So I'm talking about pimples. My name is Professor Abel Nze Onunu. I'm from the Federal University of Medical and Health Sciences, Kwale, in Delta State. And also, incidentally, my pro-chancellor is here, Dr. Silas Ubanye. Please rise up for recognition. So the Federal University of Medical Sciences is heavily represented here. The Pro-Chancellor and the Vice-Chancellor were all here. So like I said, acne is it's a chronic disease affecting the pilosebaceous units. Pilosebaceous units are part of the skin. I will describe them later. So like I said, acne vulgaris is pimples. It's characterized by the presence on the skin of what we call commendals, papules, pustules, nodules. I will show you the pictures. And the result from obstruction of the pilosebaceous unit. These are the units where the sebum comes out from in the skin. The picture here shows complications that can arise from pimples. Pimples occur not only on the face, they can appear on the chest and upper back. And when it's not properly treated, you can have this keloid, which is common in the African population, that can arise, and this may be more difficult to treat than the pimple itself. Oh, that's back. Yes, this is the diagram of the skin. The pilosebaceous units and dots. This is the glands, the dots, and this is the hair follicle coming out. So when you have blockage of this area, that one leads to the pimples forming at the top. The slide is not going. I've already talked about this. So like I said, it's very common in our populations. In hospital-based studies, in Ghana, 4.6% of the young population of people coming for treatment for acne, and then in Mali, 4.2%, in South Africa, 17.5%. So like I mentioned earlier, genetic factor, hormonal, skin infections, and of course, family history. Then the other factors I mentioned earlier too: puberty, cosmetics, stress, diet, the genetics, cosmetics. Usually the mechanisms, we talk of Haber seborrhea, there's increased production of sebum on the skin. Sebum. All these together with increased thickness of that top layer of the skin leads to the blockage of those pores, the pilosebaceous unit, and this leads to formation of what we call commendals. There are many different types, but usually we have two major types of acne, inflammatory and non-inflammatory. The inflammatory one is very more serious because it can lead to formation of cysts and nodules. This just illustrates the blockage. This is the normal ones, but here you see excess production of the sebum, and this leads to blockage. You can see it here. What we call whiteheads and blackheads. These are the open ones, and these are the closed ones. So these are the responsible for the lesions you see on the skin. Some look black, some look whitish. In terms of severity, from 1 to 5, the most severe ones are the inflammatory ones, where we have nodules and cysts. I will just show you a picture. You see the nodules on the face, the whiteheads, the blackheads. This is an example of a mild acne or mild pimples. And the second one, this is more severe, although this picture doesn't look very clear here. But you can see, in addition to the nodules and cysts, you can see the change in color. If you're not properly treated, this is the type that leads to scarring. And in blacks, it may even lead to keloid formation. So to summarize, the disease, acne or pimples, arises from blockage of these units on the skin, pilosebaceous. Several mechanisms: increased sebum production, altered sebum quality. All these lead to alteration in the barrier skin function, and all these leads to hyperkeratinization, increased thickness of that top layer of the skin, and this leads to inflammation. So I thank you.
A round of applause, ladies and gentlemen, for Professor Onu-Abel. Thank you very much, sir. That was really beautiful and straightforward. Distinguished guests, ladies and gentlemen, permit me at this point to welcome next on the presentation. And I would like to please emphasize so that we talk about more of what the machine solves, the problems that this machine solves, so that it makes a lot of sense. Ladies and gentlemen, let's welcome Dr. Ehiage Anaba. A round of applause, ladies and gentlemen, as she comes over. She's coming over. I was giving them the ginger to keep clapping until you come up here. Keep rolling. Ladies and gentlemen, keep rolling. Mom, you know, this is my English now, cram, you know.
We fit on grammar. Okay. We fit on grammar. When you fit cram, you go fit on cram. Good evening, everyone. My name is Ehiage Anaba. My slide, please. I have a very simple task. Well, I have a very simple task. Just to describe the kind of scars that we can have. So I'm waiting for the slides. So typically, when you have an injury or anything happens to the skin, we are aware of the fact that you have to heal. So if you have a cut, it has to seal up, it has to heal. You hit your hand somewhere, it's swollen, it has to heal. Now, in that process of healing, oh, thank you. My name hasn't changed. I can't move the slides. All right. So in that process of healing, it can go wrong. Okay? So typically, scars come as a result of the body trying to repair something. So there will be a destruction of the normal because now there's an injury. And following that destruction of the normal, the body is trying to repair it. Sometimes the body does oversabi and repairs beyond what it is required to do. Because of this, you end up having different types of scars. All right, so we're going to discuss those scars now. And these injuries differ. So it can be that there was a cut or you have an inflammation, like you have acne. Acne is not the only inflammation we have. Just like somebody's shaving and then they have a cut. Or somebody has a surgery. Then all of this will result in scars. So the first one we're going to talk about is the hypertrophic scars. So with hypertrophic scars, the body has done oversabi. Who sent you? So the body is laying down too much collagen. And because of this, you have this very thick skin. There's a change and it can become itchy and it's swollen. We all get to see people with that. Okay? Next, please. So that's a picture. You can see that different. So this is somebody who's had acne. That's the picture in the middle. So you have acne with keloid forming, and then those people just had different injuries with keloid forming. And typically, when you have keloid forming, it goes beyond the area of the injury. So you have a small injury, and then you now have this huge thing occurring there. Please, next. Then we have another type of scar. This time around, the body has refused to do any work. So in the course of repairing this injury, the body is not making enough collagen. Because of that, you now have this area of skin that looks like it's depressed. So we all tend to see people who have had chicken pox or you've had acne. You'd see these holes in the skin, so to speak. Or you've had a cut and somewhere along the line the skin doesn't look even. It looks like one part of the skin has gone in. So that's an atrophic scar. So that's what we're looking at here. So you can see this is these two people with acne. That person had a procedure and in the process they had that. Okay? Now we can have another one called stretch marks. And that's a big thing. Stretch marks occur for various reasons. So a young child growing up, that sudden growth spot, then you have stretch marks. Somebody's having a pregnancy, you have stretch marks. Somebody's rubbing something on the skin, stretch marks. And now, why do the stretch marks occur? Typically in the skin, there are different layers of the skin. We are talking about the dermis. Everybody's shouting dermis on TikTok and social media. It's the dermis. That's the muscle of the skin. That gives you the structure of the skin. So when they say tear in the collagen is what gives that dermis that structure. So when they say tear in the collagen or they say tear in the elastic fibers, then you have striae. And the main reason why we have to talk about striae is so physiological. Somebody is having a pregnancy, somebody is growing. Then, of course, all our brothers that are lifting dead weight, you know, the men, they want to have this, their V shape, then they have the stretch marks, okay? Then we now come to people who are rubbing all kinds of things, especially steroids, triple action. So that's just going to lead to a weakening of the collagen and the elastic fibers, and then you end up with stretch marks, striae. So my duty is just to tell you about different scars. Dr. D is going to tell you about the treatment. So we're looking at the striae. Thank you very much.
Thank you. Let's appreciate her more. Thank you very much, Dr. Hiagi Annaba. Ladies and gentlemen, permit me to welcome next as we have Dr. Zainab Baba as she comes up for the next presentation. Please a round of applause for her. Dr. Zainab Baba. You know, we have Baba, we have Baba. Baba is big and Baba is father. Please a round of applause for her.
Good evening, everyone. I wasn't too sure if yes, I do. Sorry. You know, speaking after my exam assessor, Prof. Onunu, my teacher, Dr. Annaba, it's not easy to come and stand on the same stage with them. But all the same, we have to do it because they trained us. So I was meant to talk about hyperpigmentation. Okay, just the basics. So sorry, I have to repronounce my name is Zainab Baba, not Baba. Thank you so much. So just briefly, hyperpigmentation, what is hyperpigmentation? It just means darkening of the skin in, due to excess melanin. Melanin is the pigment that we have, and more so especially in the dark skin. That's what makes our own skin dark compared to the white people. So it's common in everyone, especially more prevalent in the dark skin types. That's our own kind of population, which is usually like type 6. When you take the classification of skin phototypes. It's not a killer, so it's not fatal, but it causes a lot of psychological distress, and it's very important to identify, recognize, and take care of it. So there are many types, many things cause hyperpigmentation. Commonly post-inflammatory hyperpigmentation. What this means is that whenever you have an injury, just like Dr. Annaba said, the skin heals. And when it's about healing, it like calls help from the pigment cells, which are the melanin, and that is what gives about the dark spots, which is the hyperpigmentation. And this can occur in different skin conditions, from eczema, acne, or even just simple skin injury. It can come from, it can occur as a result in conditions like melasma, which is due to hormones and then sun exposure. Solar lentigines also, especially in the white population, you know, they have this kind of dark spots. Some call them freckles and so on. So it's also a kind of post-inflammatory it's also a kind of hyperpigmentation. Then drugs also, which are very important, like the likes of anti-malarials, people undergoing chemotherapy for cancer treatment. Sometimes you see them turning dark. This is all because of hyperpigmentation. It can occur in patients with obesity. Sometimes you notice that maybe the skin of the neck, the underarms, and some places are really dark. That is what we call acanthosis nigricans. It's just as a result of thickening of the skin. This is also a form of hyperpigmentation. It can occur in, these are all maybe like a localized form of hyperpigmentation, but it can occur throughout the body in diseases like something we call Addison's disease. You know, it can involve the whole body, but there is a way we do some tests, and then clinically we also look at some regions of the body where the pigmentation is more emphasized, like the creases of the hand, the buccal mucosa, and so on, for us to really know if it is maybe Addison's disease, and we help the patients with that. So yes, this is just, you can see the darkening, the spots. Sorry. Oh no. Okay, anyway, we can appreciate the dark patches on the skin of this patient. She had had a skin condition and it has healed with post-inflammatory hyperpigmentation. This is also a patient with acne, and I know most of us have seen similar things, and we might end up telling our relatives, especially family and friends, we're very good at that, you know, rub this, rub that, and that is the beginning of mostly their problem, instead of referring them maybe to see the specialist that could take care of this kind of problem for them. Then this one too, sun-induced, you know, you can look at, if you look at it from up there, the skin is dark, while from the breast down, I didn't have I couldn't upload the full picture. You know, the skin down is actually light, so that shows you that the exposure to the sun is what is bringing the injury to the skin, and the skin is healing by hyperpigmentation. So mostly, I've mentioned earlier, is as a result of the overproduction or irregular distribution of the melanin, which can be triggered by either sun exposure, inflammation, or hormonal factors, and is most common in our kind of patients. There are so many things to look at when you have hyperpigmentation, when it started, what are the triggers, whether the patient is on medication, the relationship with sun exposure. Some are outdoor persons. You have to know what they are using, and then how their occupation is, so that you can help them better. You have to look at the distribution of the rash, whether it's in a sun-exposed area, so that you can address that component of it. There are some other things that we use to identify whether it is a superficial hyperpigmentation or is deep, because the treatment also matters when you are when you have a hyperpigmentation. Other things, we have many treatment options to consider, like topical agents, the likes of hydroquinone, azelaic acid, retinoids. Of course, I'm not advocating that we do this kind of things, but I'm trying to just prompt our minds that there are things we use, like topical agents, which should be done under prescription. Then procedures, a lot of people now are into doing chemical pills randomly as they wish. There are treatment options, but at the same time, when done wrongly, they can lead to hyperpigmentation, and that could become a big problem. Then laser treatment is also another option, and today we'll be talking about the way to handle hyperpigmentation with lasers. Then general measures that you have to tell the individual, like sun protection or sun avoidance. Of course, we have to educate our patients, avoid picking, because that also induces more injury and inflammation, and it will heal with hyperpigmentation. Then always patients should have a realistic expectations. This treatment for hyperpigmentation is not magical. It's something that takes weeks to months to improve. So it's very important to adhere to treatment plan. Hyperpigmentation in summary is common, is multifactorial, and proper assessment guides safe and effective treatment. And then we may need combination therapy sometimes to achieve good results. And patient education and sun protection actually improves outcome. Thank you very much.
A round of applause, ladies and gentlemen, for Dr. Zainab Baba. That was really, really splendid. All of the information is provided here, upstage here, are key. And in case you're watching this live, we have a summary of the 4 presentations made here, or 3 presentations made here. And just to let you know that Dr. D is coming up to do this. And this is all about skincare. Let's welcome Dr. D to summarize all of this so we can talk about more solutions. Please a round of applause, ladies and gentlemen, to the brain behind this beautiful movement.
Thank you very much. First, I would like to apologize to non-medicals for, you know, doctors, most times we can talk and bore you guys and so on and so forth. Sorry? No. So, what I would want to do now is to try and translate a few of the things they mentioned and to highlight the essence of the gathering we have today. Now, the whole idea is for us to, the professionals, to put up the problems that we would want to treat with these machines. The first professor spoke about acne. Now, in a nutshell, what he was trying to say is that acne is a result of excess oil on the skin. This oil blocks some holes that we have on the skin, and then pimples come up because there is a reaction by the body, there's a bacteria that is there are other things that happen. And the whole idea is for us to know that acne is formed because there is excess sebum that's being blocked. And the laser we are going to present today, Acure, for the treatment of acne, exactly takes care of that. Simple. The other presentation is about scar. How is a scar formed? Scars are different, depressed, those that are thick, stretch marks. And the whole idea is we have a scar, we have stretch mark, we have acne scar, we have hypertrophic, and here we have what we are presenting, what we are launching today, the Pico laser. And it helps to improve that. The last one is hyperpigmentation, darkening. Sunburn, I mean, they call it sunburn, different kinds of sunburn. We have different sorts of hyperpigmentation for one reason or another. So the whole idea of presenting and explaining to you, sometimes in our medical terms, but in simple terms is darkening of the skin, is to let you know that the laser we're presenting, one of the two, the Pico again, helps to improve these conditions. So that's the whole gist of the matter. We would want to present a problem and give you a solution in the form of these lasers that we're presenting. At the end of the show, at the end of the launching, I'm going to show you some slides of before and after. These slides include all the problems they have mentioned and how we have managed to start treating them with these lasers and what results we already have, which are very, very promising. Now, at this stage, I think it's about time. Where is the MC? MC. Oh, so I think we have arrived at the junction where we bring in the machines. So we'd like to bring in the machines, show you the machines, launch the machines practically, and then we would continue because we have to talk more about the machines. We have a video that would play on and is going to discuss what the Pico. So actually there are 2 machines. Let me not confuse you. One is called Acure, from acne cure. So it's called Acure. The other one is called Discovery Pico, and is the one that does the hyperpigmentation, the tattoos, the stretch marks, the scars, and so on and so forth. So we are having the 2. We would bring the 2, and then we would continue with our presentation by telling you the difference between the 2 and what each one of them does. Thank you very much. So the MC has just reminded me, or told me, I mean it's his job, that we would need to invite a few of our guests to come as the machines come in, so that practically we can launch it together. I would like to invite Mr. Bondi from Quanta System, Professor Onunu. But first, I am sorry, I apologize, I'm not following the right protocol. Honorable Minister, I would appreciate, highly appreciate, if you can, you are here already, sir, if you can just participate, sir, you're already here. Dr. Kiari, please come along so that we can participate. You are the boss of all doctors here, so please come along. So,
okay. So, ladies and gentlemen, just like how we present and usher in, brides, grooms, on their wedding day, this is special. This is one in Africa. And so, ladies and gentlemen, just as the CEO mentioned, permit me to welcome our one and only machine. If we are good, please can we do that, please? One is coming from the rear and one is coming from here. And so there are two special machines, so we don't want to put them together. Everybody has his own separate job. But they are brothers. So somebody play something and let's move the machine. Move it. Are you ready? Ladies and gentlemen, all the way from the city of Abuja, permit me with a round of applause, if you can, to whom honor is due. Can we just have a little standing ovation to request as we welcome, ladies and gentlemen, all the way this is how they bring Dorime. They have to prepare well. Ladies and gentlemen, as we welcome the one and only functioning once and the first in Africa, Discovery Pico, and of course the AQ. Ladies and gentlemen, with a round of applause, if you can just watch as we're bringing in the AQ. Ladies and gentlemen, a round of applause for the one and only, the first in Africa. Somebody give this thing a big round of applause, ladies and gentlemen. Jama Atapa Atapa. Wow, somebody say wow. Ladies and gentlemen, the AQ machines live in Abuja City.